My name is Joyce Giles, and I work as a substance abuse counselor with Horizon Behavioral Health. The objective of my group are A, define perception, B, what are your perceptions of yourself doing active addiction, and C, perceptions can be misleading and give false sense of self. This group was conducted on December 1st, 2017 at 1 o'clock. The group duration was for 1 hour. It took place on the detox unit. There were 6 participants, and there was no co-leader in this particular group. We met in the group room where all the activities take place. Um, the group room is a warm, conducive environment with recovery slogans, literature, arts, works, and other client-related activities, puzzles, games, recovery movies, entertainment station. And the only groups that do not take place in the group room are your AA and NA meetings that we have here in the facility. The nature and purpose of this group is providing recovery literature as well as activities to assist clients with understanding the dynamics of addiction understanding addiction, the dynamics that further their continued use. I will be facilitating this group, and as one of many duties and tasks, there are guidelines that are utilized during the client's admission. Client's time as well as my own are short-lived due to the brief stay there on the unit. Group dynamics, the content and process. I started the meeting with introducing myself and the goals of the meeting. Rules will always be announced to set boundaries and guidelines to keep group on track, make them conscious of time. Members are demonstrating excellent eye contact, and the warm-up session that was forward in this group was they were to introduce themselves and what does perception mean to them. I'm very specific about what is expected of them in order to keep the group on task, comfortable with each other. I utilize the die technique, asking clients to pair up with one another. During this session, the clients were given an activity of drawing of a woman. They were asked to work with a partner and write down what they saw. They were allowed 5 minutes to complete the task, and after the exercise, we looked at the similarities and differences of answers. Of course, the leadership, the clients were asked to look at themselves in the mirror and what did they see, validating what they thought about their use in active addiction. And most of those comments, of course, were negative. The relational leadership is dealing with the relation theory, trying to intertwine and reiterate the importance of having relationships with yourself as well as others. The self-assessment, the group was well maintained, followed the format of the meeting. Clients were actively engaged in open discussion about their aspect of perception as it pertains to themselves. Clients were open and truthful about what they saw. Main challenges that I found that I faced during this time was getting the clients motivated to see the positive attributes of themselves versus negative. Struggling with offering positive affirmations at this time. There is nothing that I should have done differently except maybe should have increased the time of the group because it was a very good group and there were a lot of good things that needed to be shared and talked about. And also another challenge that I find is helping the clients to retrain their thinking to believe that they are worthy human beings that deserve a second chance in this life. The conclusion and application that I have highlights were meeting the objectives of the group, which was very always a very good thing when you can follow along and make sure that the group has been successful in meeting those objectives. Important things that I feel that can be taken away. Clients are open to making new changes, which was a plus. Always having these clients on board to try to do something different with their life besides continuing their use of substance abuse. I will always keep, as far as application, I will always keep the techniques in mind that were beneficial to group members in Jerry and Mary Ann's literature, evolution, strategies of group counseling. I enjoyed the readings and also watching the DVD. Some areas that I probably will work on will be timing and being flexible with maintaining unexpected situations that might arise during the group setting, and also to have a plan B action in place, or maybe a plan C or D. And what I would like to leave as a thought: two heads are always better than one. Group cohesion are rewarding and can allow clients to focus more on similarities rather than their differences. Thank you.